This morning when you hit the bathroom, did you actually look at your pee? For real, did you take a second and really look? Because if you saw foam or bubbles sitting on top of the water that didn't go away after 10 seconds, your kidneys are screaming at you. And here's the kicker. According to the National Kidney Foundation, foamy urine is one of the earliest red flags of kidney disease, and it can show up 5 to 10 years before you even feel sick. Get this, 85% of Americans over 60 never even bother to check their urine, and by the time they finally notice swelling or fatigue, they've already lost 70% of their kidney function. No joke. In the next 15 minutes, I'm going to break down the exact 10-second test you need to do every single morning, what foamy urine really means, the 6 deadly causes you gotta know about, and the action steps that could literally save your kidneys and your life. But before we dive in, let me introduce myself. I'm Dr. Martin Hale, and I created this channel to give you the straight truth about senior health. The stuff most doctors just don't have time to explain in a 7-minute appointment. If you're over 60 and you care about your kidneys, your heart, your brain, and staying independent for as long as possible, I need you to smash that subscribe button right now and turn on the bell icon. Trust me, every video I put out could save your life or the life of someone you love. This is life or death stuff, and I'm not going to sugarcoat it. All right, let's talk about foamy urine and what your body's trying to tell you. The 10-second morning urine test. Okay, so here's the deal. 90% of senior Americans have no clue that you should be checking your urine every single morning. Not just a quick glance, I mean actually looking. This simple 10-second test can catch kidney disease, diabetes, liver disease, heart failure, and even certain cancers years before blood tests pick them up. Let me show you exactly how to do it. The 10-second foamy urine test. Step 1. When you pee in the morning, your first bathroom trip of the day, hold up. Don't flush immediately. Take a look at the toilet bowl. Step 2. Check if there are bubbles or foam sitting on top of the water. Step 3. Wait 10 seconds. This part's critical. Wait the full 10 seconds. Step 4. If the bubbles or foam are still hanging around after 10 seconds and they look thick, white, or persistent, that's foamy urine. That's your kidneys waving a giant red flag. Now listen. There's a huge difference between normal bubbles and dangerous foam. Normal bubbles are large, clear, and they disappear within a few seconds, usually just from the force of the stream hitting the water. That's no big deal. But foamy urine? Totally different story. It looks like beer foam or soap suds. It's thick, white or off-white, small bubbles packed tight together, and it sits on top of the water for 10 seconds or longer. Sometimes it looks like beaten egg whites or shaving cream. That's protein in your urine, and that's a medical emergency waiting to happen. Real talk, let me share a case with you. I had a patient, Barbara, 66 years old, who came in for a routine checkup. During our conversation, I asked her if she'd noticed anything weird about her urine. She goes, "Well, now that you mention it, it's been looking kind of foamy for a few months, but I figured it was just dehydration." When we ran her urine tests, boom, she was spilling massive amounts of protein, over 3 grams per day. Her kidneys were failing, and she had zero idea. She wasn't swollen, she wasn't tired, she felt totally fine. We caught it early enough to slow things down, but here's the thing. If she'd waited another year, she would have been looking at dialysis. Get this. According to a study published in the American Journal of Kidney Diseases, persistent foamy urine shows up in 80% of people with significant proteinuria. That's protein leaking into your urine. The Journal of the American Medical Association says proteinuria is hands down the single best predictor of kidney disease progression and cardiovascular death in people over 60. And here's what blows my mind. Most people just ignore foamy urine for months or even years because they don't know it's a warning sign. The National Institute of Diabetes and Digestive and Kidney Diseases found that early detection of proteinuria through just looking at your pee can reduce the progression to kidney failure by 50%. That's why this 10-second test every morning is so huge. You don't need a lab, you don't need a doctor's appointment. You just gotta look. And if you see persistent foam, you gotta act immediately. The 6 deadly causes of foamy urine. All right, let's break down what's actually causing that foam in your urine, because it's rarely just one thing, and some causes are way more dangerous than others. Cause number 1, kidney disease and proteinuria. The number 1 cause of foamy urine is kidney disease causing proteinuria, protein leaking into your urine. Your kidneys have tiny filters called glomeruli that are supposed to keep protein in your bloodstream while filtering out waste. When these filters get damaged, from diabetes, high blood pressure, autoimmune diseases, or infections, protein starts leaking through. According to the American Kidney Fund, over 37 million Americans have chronic kidney disease, and 90% don't know it in the early stages. Get this. A landmark study in Kidney International found that people over 60 with persistent proteinuria have a 3.2 times higher risk of progressing to kidney failure and a 2.7 times higher risk of cardiovascular death compared to those without proteinuria. Here's what 85% of senior Americans don't realize. You can have severe kidney disease with 0 symptoms except foamy urine, no pain, no swelling, no fatigue, just foam. By the time you feel sick, you've lost most of your kidney function. That's why the 10-second morning test is so critical. Cause number 2, uncontrolled diabetes. Okay, real talk. The second major cause of foamy urine is diabetes, especially uncontrolled type 2 diabetes. High blood sugar damages the tiny blood vessels in your kidneys, leading to a condition called diabetic nephropathy. According to the American Diabetes Association, diabetes is the leading cause of kidney failure in the United States, accounting for 44% of all new cases. Here's what 90% of Americans with diabetes don't know. Diabetic kidney disease can start years before you have any symptoms. The first sign is often microalbuminuria, small amounts of protein in your urine that make it look foamy. A study in diabetes care found that 30 to 40% of people with type 2 diabetes will develop kidney disease, and most don't find out until they're in advanced stages. I had a patient, Richard, 71 years old, who'd been diabetic for 15 years. His blood sugar control was all over the place, HbA1c around 9%. He casually mentioned that his urine had been foamy for about 6 months. When we tested him, bam, stage 3 kidney disease with significant protein loss. His previous doctor had never even asked about his urine appearance. We got his diabetes under tight control, started him on kidney protective medications, and caught the progression early. But so many people aren't that lucky. Cause number 3, high blood pressure. The third cause is chronic high blood pressure, hypertension. Uncontrolled high blood pressure damages the blood vessels in your kidneys, reducing their ability to filter waste and causing protein to leak. The Centers for Disease Control reports that nearly 50% of American adults have high blood pressure, and the rates are even higher in people over 60. According to a study in the journal Hypertension, people with untreated or poorly controlled blood pressure who develop proteinuria have a 5 times higher risk of progressing to end-stage kidney disease. The scary part? High blood pressure often has no symptoms. You feel fine, your kidneys are being destroyed, and the only clue is foamy urine. Cause number 4, dehydration. The fourth cause, and this is the one most people hope for, is severe dehydration. When you're dehydrated, your urine becomes very concentrated, and the higher concentration of waste products can sometimes create foam. The difference here is that dehydration-related foam usually goes away within a day or two once you start drinking more water. Here's the test, folks. If you see foamy urine, crank up your water intake for 48 hours. Drink at least 8 to 10 glasses of water per day. If the foam completely goes away, it was probably dehydration. But here's the catch. If the foam sticks around after 48 hours of proper hydration, it's not dehydration, it's something serious, and you gotta see a doctor immediately. A study in the Clinical Journal of the American Society of Nephrology found that chronic dehydration in seniors significantly increases the risk of kidney disease progression. So even if dehydration is causing your foamy urine, you gotta fix it permanently by staying hydrated. Cause number 5. Urinary tract infections. The fifth cause is infections, specifically urinary tract infections, or UTIs, or kidney infections called pyelonephritis. Infections can cause protein, white blood cells, and bacteria to appear in your urine, creating foam. According to the Infectious Disease Society of America, UTIs are incredibly common in people over 60, especially women, and they often show up with unusual symptoms or no symptoms at all except foamy or cloudy urine. If your foamy urine is accompanied by burning when you pee, back pain, fever, or foul-smelling urine, you likely have an infection. This is treatable with antibiotics, but it needs to be addressed quickly because untreated kidney infections can cause permanent kidney damage. The Journal of Urology found that recurrent UTIs in seniors increase the risk of chronic kidney disease by 60%. Cause number 6, heart failure. The sixth and often overlooked cause is congestive heart failure. When your heart isn't pumping efficiently, fluid backs up in your body, increasing pressure in your kidneys and causing protein to leak into your urine. A study in the Journal of the American College of Cardiology found that 60% of people with moderate to severe heart failure have proteinuria, and most don't know it. If you have foamy urine along with swelling in your ankles or legs, shortness of breath, fatigue, or difficulty lying flat, you could have heart failure. This is a life-threatening condition that requires immediate medical attention. The American Heart Association reports that heart failure affects over 6 million American adults, and early detection through symptoms like foamy urine can improve outcomes dramatically. Other warning signs you're ignoring. Look, 85% of Americans over 60 totally miss this. Foamy urine is almost never the only warning sign your kidneys are giving you. Your body is screaming for help through multiple signals, but most people don't connect the dots until it's way too late. Let me show you the other warning signs you gotta watch for alongside foamy urine. Warning sign number 1. Swelling. When your kidneys aren't filtering protein properly, fluid builds up in your tissues, causing swelling, usually in your ankles, feet, legs, or around your eyes. This is called edema. According to the Mayo Clinic, edema combined with foamy urine is a strong indicator of nephrotic syndrome, a serious kidney condition where you're losing massive amounts of protein. I had a patient, Linda, 68 years old, who noticed her wedding ring was getting tight and her ankles were swollen at the end of the day. She also had foamy urine but didn't mention it until I specifically asked. When we tested her, bam, she was in full-blown nephrotic syndrome, losing over 5 grams of protein daily. That's life-threatening. We started aggressive treatment immediately, but if she'd waited another month, she could have developed blood clots or infections. Warning. Sign number 2, fatigue and weakness. When you're losing protein in your urine, you're losing essential building blocks your body needs for energy and muscle function. Many people with proteinuria experience overwhelming fatigue, weakness, and difficulty concentrating. A study in the American Journal of Nephrology found that 70% of people with significant protein loss report chronic fatigue months before being diagnosed with kidney disease. Warning, sign number 3, changes in urination. If you're getting up multiple times at night to pee, that's called nocturia, or if you're urinating way more or way less than usual, combined with foamy urine, that's a red flag. The National Kidney Foundation reports that changes in urination patterns are among the earliest signs of kidney dysfunction, but most people just brush it off as getting older. Warning. Sign number 4, high blood pressure. That's hard to control. If you've been on blood pressure meds for years and suddenly your blood pressure is spiking or becoming harder to control, and you have foamy urine, your kidneys could be the problem. Damaged kidneys cause high blood pressure, which further damages the kidneys. It's a vicious cycle. According to the American Society of Hypertension, resistant hypertension in people over 60 is often caused by underlying kidney disease. Warning, sign number 5, unexplained weight gain. Rapid, unexplained weight gain, especially 5 to 10 pounds in a week, combined with foamy urine usually means fluid retention from kidney dysfunction. The weight isn't from fat, it's from fluid your kidneys can't remove. This is a medical emergency and requires immediate evaluation. The tests you need. All right, listen up. Let's talk about exactly what tests you need if you have foamy urine, because this is where most people get totally lost in the medical system. You gotta know what to ask for and what the results mean so you can stand up for yourself. Test number 1. Urinalysis. This is the most basic test. You pee in a cup, and the lab checks for protein, blood, white blood cells, bacteria, and other abnormalities. If protein is detected, the lab will measure it. Normal urine should have little to no protein, less than 150 milligrams per day. Anything above that is abnormal. Test number 2, urine albumin to creatinine ratio. This is the gold standard test for detecting early kidney disease. It measures the ratio of albumin, a type of protein, to creatinine, which is a waste product, in your urine. A normal result is less than 30 milligrams per gram. A result of 30 to 300 indicates early kidney damage. A result above 300 indicates advanced kidney damage. According to the American Diabetes Association, anyone over 60 with diabetes, high blood pressure, or foamy urine should have this test at least once a year. A study in the New England Journal of Medicine found that early treatment based on these results can reduce the risk of kidney failure by 40%. Test number 3, 24-hour urine collection. If your initial tests show significant protein, your doctor may order a 24-hour urine collection. You collect all your urine for 24 hours in a jug, and the lab measures the total amount of protein. Normal is less than 150 milligrams per day. Anything over 3,500 milligrams per day is considered nephrotic range proteinuria and requires aggressive treatment. Test number 4, blood test for creatinine and GFR. This blood test measures how well your kidneys are filtering waste. Creatinine is a waste product from muscle breakdown. When your kidneys are damaged, creatinine builds up in your blood. The lab uses your creatinine level to calculate your GFR, that's glomerular filtration rate, the percentage of kidney function you have left. Normal GFR is above 90. Stage 1 kidney disease is 60 to 90 with damage. Stage 2 is 45 to 60. Stage 3 is 30 to 45. Stage 4 is 15 to 30. Stage 5 is below 15. That's kidney failure requiring dialysis. Here's what 90% of Americans don't know. You can lose 50% of your kidney function and still feel totally normal. That's why testing is so critical. Test number 5, kidney ultrasound. If your urine and blood tests show kidney disease, your doctor may order an ultrasound to look at the size and structure of your kidneys. This can identify blockages, cysts, tumors, or scarring. It's painless and non-invasive. The 7-step action plan. Bottom line, folks, let's get to the action steps. Exactly what you need to do starting today if you have foamy urine or if you want to prevent kidney disease. Action step number 1, do the 10-second test. Every morning. Starting tomorrow morning, look at your urine every single day. Wait 10 seconds and check for persistent foam. Keep a small notebook in your bathroom and note any changes. If you see foam for more than 2 to 3 days in a row, that's your cue to act. Action step number 2, get tested immediately. If you have persistent foamy urine, call your doctor today, not next week, not next month, today. Ask for a urinalysis, albumin to creatinine ratio, serum creatinine, and GFR. If your doctor dismisses your concerns, find a new doctor. This is your life, and you have the right to demand testing. Action. Step number 3, drink more water. Aim for at least 8 to 10 glasses of water daily. Proper hydration supports kidney function and helps flush out toxins. A study in the Clinical Journal of the American Society of Nephrology found that seniors who drank adequate water had 30% slower kidney disease progression compared to those who were chronically dehydrated. Action. Step number 4, control your blood sugar and blood pressure. If you have diabetes, get your HbA1c below 7%. If you have high blood pressure, get it below 130/80. These are the 2 leading causes of kidney failure, and controlling them can literally save your kidneys. According to the National Kidney Foundation, controlling blood sugar and blood pressure can reduce the risk of kidney disease progression by 60 to 70%. Action. Step number 5. Watch your protein intake. If you're diagnosed with proteinuria, talk to your doctor or a dietitian about moderating your protein intake. Too much protein, especially from red meat, can stress damaged kidneys. The kidney disease outcomes. Quality Initiative recommends 0.8 grams of protein per kilogram of body weight for people with kidney disease. Action. Step number 6. Avoid kidney toxic medications. Review all your medications with your doctor. Avoid NSAIDs like ibuprofen and naproxen, certain antibiotics, and other drugs that damage kidneys. These medications are especially dangerous for people over 60. Action. Step number 7. Get annual kidney screening. Every person over 60 should have their kidney function tested at least once a year. Urinalysis, albumin to creatinine ratio, creatinine, and GFR. If you have diabetes, high blood pressure, or a family history of kidney disease, get tested twice a year. Early detection saves lives. Listen to me very carefully, folks. Foamy urine is not something you brush off. It's not something you Google and then forget about. It's your kidneys sending you an SOS, and you've got a narrow window to act before the damage becomes permanent. Once your kidneys fail, there's no going back. You're looking at dialysis 3 times a week for the rest of your life, or a kidney transplant if you're lucky enough to get one. But here's the good news. You now have the knowledge that 85% of Americans over 60 don't have. You know what to look for, you know what it means, and you know exactly what to do. That puts you miles ahead of millions of people who are walking around with failing kidneys and zero clue. So here's what I need you to do right now, okay? First, subscribe to Dr. Martin Hale. Hit that subscribe button and turn on notifications. Every single week, I'm bringing you senior health information that could save your life, information your doctor might not have time to explain. Topics like heart health, brain health, medication dangers, cancer screening, and preventive care designed specifically for people over 60. Second, share this video with every person over 60 in your life. Your parents, your spouse, your siblings, your friends, someone you know has foamy urine right now and has no idea it's a warning sign. You could literally save their kidneys, their independence, and their life by sharing this video. Third, leave a comment below and tell me, have you noticed foamy urine? How long has it been going on? What's your biggest concern about kidney health? I read every single comment, and I use your questions to create future videos. And finally, take action today. Do the 10-second test tomorrow morning. If you see foam, call your doctor and demand testing. Don't wait. Don't procrastinate. Don't hope it goes away on its own. Your kidneys are depending on you. Until next time, this is Dr. Martin Hale reminding you, your health is in your hands, and small actions today can prevent devastating consequences tomorrow. Take care of yourself. You're worth it.